In my industry, I want more Filipino leaders out there.
Today, we sit down with Grace Lanceta, registered nurse and owner of CRD College of Healthcare in Mississauga.
We have 200 or over 200 students. I have a lot of students who are victim of abuse. The international student brings a lot of revenue to colleges. I just don't want to mass produce students, but I want quality students. They want to get certified because they want to work in the healthcare industry. I want them to be empowered as a woman.
Welcome to another episode of Thrive in Canada, the show that connects newcomers and aspiring professionals with the tools, stories, and services that help them succeed. If you're an internationally educated nurse, a newcomer exploring healthcare careers, or someone dreaming of maybe building a meaningful business in Canada, this episode is for you. Today, we sit down with Grace Lanceta. She's a registered nurse and the college director and owner of CRD College of Healthcare in Mississauga. With a background in trauma nursing and a deep commitment to education, Grace took the leap from frontline care to founding a private career college that now empowers both domestic and international students. Under her leadership, CRD College has become a designated learning institution recognized by the IRCC, or the Immigration, Refugees, and Citizenship Canada, offering hands-on programs like PSW, or Personal Support Worker, Developmental Services Worker, or DSW, and Food Service Worker, or FSW, among others. So, Grace, welcome to Thrive in Canada. Thank you for making it to the show.
Thank you too for inviting me.
So first of all, Grace, I wanted to ask about CRD College. Can you tell us briefly about how it started, what kind of services the school offers?
Well, CRD College had been there since 2004, if I'm not mistaken. But I took the ownership in 2011. It was a small school, nothing really in there. They're teaching basically PSW, Personal Support Worker program. And that time, I was at the height of my nursing career in the hospital. I was doing some work in policy research in the hospital. And then I just jumped off. I said, I want that college. So I took over that college. Coming from a big hospital, it's a small career college, nobody heard of, right? So I only have 7 students there. And basically, those students already paid the previous owner. So nothing really for me there. But I said, this is where I can work more. It's more of an inspiring to start from scratch. And see what will happen with this college. And
so you saw all the potentials and something that you wanted to do. And this could be the vehicle to that.
Correct. And even when I was in the hospital, I was working, I'm an employee. Yes, I have, I'm happy with what I have in the hospital. But there's something, probably, I guess, I'm more of a visionary and an entrepreneur in a way. So then being an employee, really will do it because it's my job. But there's more to it that I said I can do more if I'm not an employee.
Something was asking to come out.
Correct.
And so you saw that. You took over a college that had 7 students.
Yes,
and
yes.
How did you expand it? And what was your vision?
Well, I kind of laid out what the college would be. So first, mostly Filipinos in there. And with my background in the hospital, I'm always for the multicultural. So I said, I want to turn this school into a multicultural school. I won't just stop catering Filipinos, but I want different cultures in this college. So that's how. And I first built the financial aspect of the school. And then gradually went into, I said, the next step is let's go out and have more accreditation for the school. It really helps with my background in policy research. So I'm good in writing proposals, project proposals. Then I entered into the designated learning institution at when they started opening the international students in Canada. The college was one of Filipino-owned who became designated for the international student program.
I'm not sure if we have a lot of that like Filipino-owned private colleges? Or at least maybe if we have significant number of seating in these private colleges?
Yeah,
you know?
we have few Filipino-owned private career college. Basically, they cater more on PSW, and we have some who end up becoming a big institution, private career college, and some of them were sold to to a corporation. But there were some Filipino entrepreneurs in there, and that's where I'm advocating to other Filipino owners, let's build quality education rather than I understand the money part. Running a private career college can be rewarding in a way that you can earn a living there. But let's not forget that it's not just about the money, it's about the quality of education that we will be providing. So that's what I'm advocating with career colleges, because there's a lot of stereotypes with private career colleges. Oh, they're
Right.
just money maker, they're
Right.
money grabbers, those things. And even in the media, where if there's to blame right away with education, the first sector to be blamed will be the private sector, or there's a scam out there. Then I try to advocate with that one. I want to show to the public, to the community, that not all private career college are a sham. And they're Filipino-owned. We have good private career college who really take time to mentor students, even at night. Not only mentoring them, but also giving them mental health first aid too. And some of these colleges, small colleges, are basically really working hard to help their students. And those are the things that not only for my college, but I want to advocate for small colleges. Because the population that we have, they're not the kind of students who will go to a university, who will go to community colleges. First thing, they won't thrive in the community colleges with the strict rules. And more so with the university, they don't have time and money to do that. Why I say that? Because our population, in terms of uniqueness, is that our population these are abused women, single parent, and working odd jobs, and all they want is just a career so they can have a bit of better salary with a certification. You know how it is here in Canada. For you to get a job, you need to be certified in all sorts. Those are the kind of students that we have.
So you're serving very specific part of the community, which are also very essential.
Yes.
And it's good to put this in the light, because like what you said, there's so many issues regarding the private colleges. And I wanted to ask, diversion a little bit. Did you get affected with the changes in the system with international students?
Big time. The international student brings a lot of revenue to colleges, not only to private career college,
Right.
but to universities and the entire education
government-funded
system.
DLIs,
So,
yeah.
yes. And with us, we've been affected already way before they made some changes. Was that in 2024, I think? We were already affected, the private career college sectors. We were stripped of the post-graduation work permit at the time. With that, we're only getting few international students who won't make it in the university or community colleges, so they end up coming to us. But few percentage of international students. The big private career colleges, who are the corporate private career colleges, end up partnering with universities, community colleges, so they end up partnering so that their students end up getting a PGWP, the post-graduation work permit. I don't have the exact figure, but very few percentage in my college that we have international students. With that, as an entrepreneur, I did not become dependent of the international student program. I never become dependent on that.
Okay, that was a wise move from
Yes, so
from before. Otherwise,
correct.
It could have maimed your.
Yes, I'm always one step ahead when it comes to the college. What am I projecting? What could be the policies that will change soon? So I try to be sensitive in that sense on those issues, and so that I can plan ahead. And then so my business won't be affected. In a way, I get affected, but not much. So when they announce in 2024 the changes, it's been 6 months that I'm already not much enrolling. If international student comes to me, good. If not, I'm okay, right?
What's the population of the college now?
We have probably close to 200 or over 200 students right now in the college. It's not something that I'm really used to.
That's a pretty significant number.
Yes.
Of people that you are servicing, and in terms of the future that they can have after getting the education that they're
Yes.
getting from CRD. So let's dive into those programs. It's good that we have an idea on who your students are. I mean, these are not, like what you were saying earlier, these are not the same people who will go to a university or a community college. A private college like yours is a legitimate option. It's not a lower option than these other post-secondary institutions, because it offers a unique set of educational skills in your toolkit. So let's talk about the first program, which is PSW. Tell us about that. Who is it for? Who benefits from it among those who are watching us right now? If they're in a certain situation, maybe this is for them.
The personal support worker, that's basically a nursing assistant program. It's actually the door to the healthcare field. So it's a very short program. Full-time is around 5 months to 6 months. It depends on the school. Some schools have longer program for the personal support worker. And with us, we kind of accelerated to a 21 below 6-month program. There's a reason for that, because there are some students who are actually not yet permanent resident. They may be on a work visa, on a post-graduation work permit, some international students on post-graduation work permit, that they're not allowed to go to school more than 6 months. So then the 5-month program will benefit them. So basically, PSW is a plain nursing assistant, and they don't do medical care, but more on the person. It's a personal care that they do cater, and our senior population is growing.
Right.
And with the population growing, of course, they will be needing personal support work, not for medical reason, but it's part of the medical condition that they have, but they don't need a licensed nurse to be there with them just to do those personal care. Instead, they need personal support work.
So it's a 5-month course, which, as you said, some other offer it in an even shorter course, but I guess you wanted to maximize what you can teach them. But still, that's a very wise move, no? Because some non-permanent residents have restrictions in their work permits.
Correct.
And that's why it's below 6 months. And
yes.
Give us an idea of the cost and like how it is in the job force afterwards.
This is a career that's very in demand right now. With the growing population of seniors, so there's always job for personal support worker. And the good thing with personal support worker is that they're not dependent on one area of healthcare. So some personal support worker graduates will work in the hospital as nursing assistant. Some of them will work in the nursing home, which a lot of them work in the nursing home, or we call it long-term care. And some of them will work in retirement homes or seniors' home. And some of them will work in community or home care, we call. And with that, I seldom see PSW who only work in one area. Same goes with the nurse. I remember when I was a nurse, I don't work just in the hospital, but on my off days, I work in the community as a community nurse. Though I love the hospital, I'm not sure if how good I am as a community nurse, but I did my job as a community nurse. That's just for me to add more money to myself on top of my regular salary. And a lot of the nurses and a lot of the PSWs are doing that one. So when they're off in the facility, they do community work. Then that adds to their source of income.
Right.
I'm very sure a lot of the personal support workers are not working. When they ask me, how many hours the PSW work in a week? 40 hours? I said, I haven't seen a personal support worker who works 40 hours a week. Probably the minimum that they will work will be 50 to 60 hours. And I even heard some personal support workers working 80
hours
a week. I said, like, that's why I always, and those are some of my graduates too. And I always tell them, like, you have to preserve yourself. We take care of other people a lot, but we don't take care of ourselves. Like, yes, it's easy to we earn, but at the end of the day, you also have to look at your health.
Yes.
Not just your physical health, but your mental health. And
the other aspects of your life, connection with other people.
Yes, that's correct.
Self-care.
That's
and they
true.
have to do this because the salary of a PSW is not much?
Well, I would say I'm advocating for more. They started before $20 an hour, but now I believe they're on the $25 range, after the pandemic. And then, so I'm advocating for more for that. Because the job that they're doing is not a joke. It's, you need to be physically fit. It's not just about you being physically fit. You have to be mentally fit because it's a stressful job. And if you're not that strong enough, physically, mentally, and spiritually, you're gonna give in. And that's why when they were telling me, you know what, people are telling me that we just change diapers, underwears, and clean. I said, those are personal care, which even me as a nurse, and mind you, in healthcare, the higher education you get, the more it gets messier. And
is that so?
The more it gets messier. So, and dealing with those personal stuff with clients, it's part. We're taking care of the human body. We cannot just exclude things. You have to take care of the whole body, not just one piece. So I said, if somebody get a wound, they are in pain not only on that part of their finger, but they're in pain in other parts of their body. So you cannot be, as a healthcare worker, you cannot be, I'm only taking care of your finger, but I don't care about your legs and your head and other parts of your body. We embrace the whole body because that's part of the human body. So,
and this is the beauty of having a Filipino director for a school, because this is the Filipino brand of caring.
Correct.
Right? And you are teaching that multiculturally. And it's good for them to know this also, because we have heard stories of some PSWs who use the pathway to become permanent residents in Canada, but whose heart is not really in being a PSW. They just find it as the most convenient way to get their papers and documents.
Yes.
So if they're going to be in it, then they better, and if they go to your school, then they're going to learn the brand of Filipino care that we're known for.
That's one thing too, that I know that there's an explosion of students going into personal support worker as the immigration policy changes. They run to the healthcare because they think that the healthcare is their way to get their permanent residency. And that's where, with more population we have, because I'm used with catering to all my students. With more population that we have, that's where I'm also becoming uncomfortable and have to be watchful to who are we accepting in the program. Because I always have the principle ever since. I never, yes, I love the money of the mass production of PSW students, but on the other hand, I'm also a nurse. And I have my moral responsibility there and professional responsibility there, that I want the community to be safe in the hands of the PSW. And when they say, it's just a PSW, no. PSW can also hurt people. So I want to make sure that whoever that we produce are personal support workers who are safe to do their job in the community and also make themselves safe. Because if they do something that is not right, then they may end up going to jail. They have their accountability in there. So I just don't want to mass produce students, but I want quality students. What's the point of me having a lot of money, having a lot of students, then bringing more revenue to the school? It's a good thing. But on the other hand, what kind of product are we producing? And at the end of the day, it's all about the quality, not the quantity.
Who among those who are watching us can be PSWs?
Well, anyone can be a PSW, even if you're just if you're a high school graduate, you haven't gone to college, you can be a PSW as long as you're 18 years old and above. The thing is, you need to have the heart. You need to have the heart to take care and patience to take care of the person. If you don't have that one, I discourage you to take the program, because when you don't like the job, you will resent that job. And when you resent that job, you're not taking care of a piece of wood. You're taking care of a person. And this person are somebody's mom, somebody's parents, somebody's family who they love. And when you don't have that heart to take care of people, then you may end up abusing this person unconsciously, consciously or unconsciously. Then there's no place for you in this field. So the most important thing is that, some of them, they said, but I haven't been in school for so many years. I said, that can be worked on.
That's not the most important thing.
Yeah, the most important thing is
if you have
this
the
one.
heart, and
Then you can.
Then
right?
you can. We'll settle with the other things. The other factors can be worked on.
Yes,
That's
yes.
the most
Because
important thing.
these are learned things, and then we can even sit down with you. What are those are easy to settle, but the most difficult thing is if you don't have that one, then better not do it.
Right. And it can be a stepping stone to nursing as well.
Yes, it is. Yes, a lot of our students, some of the students who are in the IFCNA event last weekend were they were basically some of our graduates, and then they end up becoming a nurse. I see a lot of our graduates end up becoming a nurse.
Okay, so it's not a requirement to be a PSW first before you become an RPN, for example, but it would be helpful, I suppose?
Yes, it's helpful in when you go into a nursing program. Of course, they also screen people who goes into the nursing program. And if you're already working as a personal support worker, then they know you are into that field.
Okay, so it helps in that manner.
Yes.
Do you encourage those who want to eventually be nurses to take PSW first, or who is it for in terms of if their intention is to become a practicing nurse?
I don't encourage directly to the nurse. If they're international educated nursing professional, they come. With me being a nurse, I'm also an international educated nursing professional. I want them to be a nurse right away.
Right.
But on the other hand, we have to also face the reality that when you come in here, you don't get that nursing license right away. It's a struggle. And that's why IFCNA is there to mentor them for that. But because it's a struggle, and if you wait for your nursing license to get a job, then good luck with that. That will, and at the end of the day, you're looking at, you have kids. You need to survive. You have to pay your rent. You have to do this one. And a lot of times, they end up doing other odd jobs, like go to a factory, and there's nothing wrong with the job. Do other odd jobs just to make some money to support themselves. And if they do the PSW program, it's a good thing. They're already in the field.
So at least instead of doing other odd jobs that are not related to nursing at all, then they could probably benefit from from getting into a PSW program.
At least they're on the right track, right? They already entered the door. So let's say, for example, if somebody, a newcomer, they're doing odd jobs, but if they do the personal support worker, they end up working in the hospital as a personal support worker. And then by the time they get their nursing license, they're already inside the hospital because, so it's more easier for the organization to hire an internal applicant than the external applicant. So if you're already there, even if you're working as a personal support worker, then it's easier for you to transition to your nursing once you get your nursing license.
Correct. So what about the other program, the Developmental Services Worker? What are they? What do they do?
Well, the Developmental Services Worker is a career that it's a diploma program that they basically work in community living, supporting people living with developmental disabilities like autism, Down syndrome, and other developmental disability people. So they're there to support. They're more dealing of, not more on the personal compared to the PSW, but more on the behavioral.
Right.
So they use more of psychology in there and behavioral support for the people that they support.
So this is a longer program.
It's a longer 1-year diploma program. And for those who don't want to do the personal support worker, then they don't want the messy job of the personal support work, then they opt to go for the developmental service worker. So where they do more of the interaction, more of the behavioral support rather than the physical support.
You mentioned for getting into the PSW program, you don't even have to have a college degree or have stepped into college. What about for the DSW? What are the requirements?
Same thing. You just need to be an 18-year-old, above 18 and above. That's we don't want below 18 in there. It's just a course requirement. And you need to pass your English literacy, and the other exams, you need to pass your scholastic level. And we call those people that we enroll, those students we enroll, mature student. So anything 18-year-old and above, they haven't gone to to high school. They just finished high school. They don't have so we call them as mature student. We enroll them under the mature student program.
Okay, and then who is it for?
The developmental service worker, anyone, some professionals for newcomers, those who have teaching background, psychologists who has not become licensed yet here, and they will be interested on those stuff because it's more related to their job.
Field.
Yeah, to their field.
The psychologists, are they also waiting for their license here?
Yes.
Similar to the nurses?
Correct, because these are regulated professionals.
Right. So 1-year program, and then they can, I suppose they easily can get a job.
Yes.
Anything in these, all of the programs that you're offering
Correct.
are very in demand.
Yes, correct.
In the whole of Canada.
Yes. So some of the developmental service worker end up becoming behavioral therapists as well. So they venture into behavioral therapy, and some venture into psychology. Mostly of my students, they end up becoming behavioral therapists in the end. There's somebody asked me, why you only have few courses, vocational courses? I'm very careful with the course that I offer. I can have 100 of courses in there, but what's good with the college if those courses are not giving them jobs?
Right.
So I kind of carefully choose.
There's also something great about having specializations, making sure that these areas have a mastery, or at least for you in the administrative level, you're very well in control of these.
Yes. So we're expert on that
programs.
field.
Exactly.
Right? And then, like I said, I cannot offer courses that I'm not familiar, and I cannot offer courses that has no job. They come to the school, yes, that's good. They pay their school fee, I get money, but when I see them not working, then it's disappointing, right? So what's the point of that money if the student don't even succeed? So I want my student to succeed. So that's why I'm careful with the courses that I choose. If I have to bring in more courses in there, then I really I really do my research. Is there a job market with this course? And if not, forget about it.
Right. What are the profile of the people who would be interested in being developmental services worker?
Majority of our students are really, I don't want to do the personal
PSW.
job of a PSW. Is there something that we can do? And the DSW, when they see the description of the course, I want this one. And some of them are also personal support worker who'd been working for 20 years. They don't want to do the heavy job. They want to slow down with their job. So then they end up doing the DSW. Because with the DSW, it's more, they said, yes, I can do the behavior. I've been working with dementia people for supporting dementia people, so I know behaviors. And so then it's time for me to slow down. If they're working in a group home as DSW, they're only catering for 5 people. and they don't do personal care unless there's an emergency on the
Right.
with the person, but they don't do much of the personal care. They do much on the behavioral side.
So no need to have a psychology background, for
No need, no
example,
need.
whether you're just outside of high school or you've
Yeah.
been in the industry for a long time
Yeah,
and want to
yeah.
pivot into something
Yes, yeah.
different or something that maybe is better for you in terms
Yes.
of load, in terms of your age. If
Correct,
you're already
correct.
advancing in age and you can't do the heavy lifting
Yes.
that the PSW
Yes.
does, literally heavy lifting, right? Okay, so what about the FSW or food service worker?
The food service worker is a very short course. It's like a 4-month course, vocational. The one that we have in the food service worker, well, if you get the food service worker certificate, like, you can work in a restaurant, but even if you don't have, like, people will work in the restaurant without the certificate. But with us, it's very specialized because the food service worker that we have are geared towards working in the dietary department of nursing homes, hospitals. So that's how they do their practical training in nursing homes, preparing special diets for residents, the organization of the nursing home or hospitals. So that's the food service worker.
Oh, so it's very specialized that you
Yes,
can work
yes.
in healthcare
Yes.
related institutions.
Correct.
Okay.
Yes.
That also sounds like something in demand. Like what you said, all your programs, you really want to have them to land a job right
Yes.
after and be successful in what they do. So who do you think, because I was thinking of that, like, for example, they want to work in restaurants and get the certification. They can also take this.
Yeah, they can also take that one.
But
Yeah.
this will be a little bit too specialized for that.
Yeah.
They don't need this to
Yes.
work in restaurants.
Yes.
Who will be interested in a program like this?
We actually have several students who was working in the restaurant. They want to get certified because they want to work in the healthcare industry, in the food sector of the healthcare industry. So those are people who, I have some students who were already cook. And they just want to get certified and work in the industry, in healthcare industry.
So there's a different certification needed to be able to work in the food services within the healthcare industry.
Yes,
Wow.
yes.
Okay.
Because it's a specialized,
Right.
it's not a regular food that they will just prepare.
Right.
Like, majority are specialized food with special diets.
So what kind of things do you teach in this program? What can they expect in terms of the curriculum?
In the food service worker. Well, because it's very short, so it's just 2 months in theory, and then another 2 months in the practice. So, and then a lot of them, like, a lot of our students end up, they just want a short one, and then, but
Right.
on the other hand, they also ask me when they enroll, because they're trying to contemplate, should I do the PSW or the food? And then the question is, which is the one that will give me more money?
Which one pays
Yeah,
more?
pays
Yeah.
more, right? So that's
What's the answer to that? I'm
yeah,
sure
that's
our
the answer
audience
to
also
that.
want to find out.
Yeah, so that's one thing, and then they end up, some end up going into they started asking about the food service worker, and then they end up going the personal support worker. Some really like, I really want the food career, so then they go for that.
But what's the answer to which one has more money afterwards? Is it PSW or
sorry.
FSW?
It's the PSW. The PSW, it's because with the food service worker, you get more money in terms of salary if you're working in government-funded organizations. Then the rate is more higher. But if you go into private facilities, then the rate is lower. For the PSW, the thing with the PSW is you jump from one organization to another organization. You can have 3 organization
same
employers. Then that's where you get more money.
Right.
And then, of course, the rate is more higher for the PSW. But you
Okay.
have to understand, too, that the
what the work
PSW job is stressful. It's heavy.
Do you recommend them getting 2 jobs as a PSW? That's still okay? More than 2 jobs is too much, or when is it too much? knowing that it's a stressful and mentally challenging job.
Yeah, it's really hard to recommend, right? Because it depends on their needs, on their
that's true.
financial needs.
That's true.
On the other hand, I always discourage them, don't overdo it. So like, if you're working Monday to Sunday,
That's too much.
what that leaves you, but a lot of the health workers are doing
Right.
that one.
Correct.
That's why I'm advocating for, because you may end up having burnout with that one. And that's common among nurses. That's common among PSWs doing 7 days a week,
Maybe
2
something
jobs.
has to be done as well with our lifestyle, probably. Do you buy too much? Why do you need all these? If you already are working Monday to Sunday, I don't know, let me know. But like, these jobs do give a good wage already. But of course, the standard of living is getting higher also. But prioritizing your health, you're also going to have to cut down on some things. Like, do you have Starbucks coffee every day? Maybe something you can give up and it'll give you, an additional 3 to 4 hours of sleep?
With Filipinos, it's not about the lifestyle here. Yes, we can.
It's
But
about
you
sending money back
sending
home.
money in the home country.
Philippines. Correct.
So that's the reason why they're doing
Right.
a lot of hours there.
That's
because
true.
more hours for them, more money for them. So with me, I send money with my family. I send money to my mom, and I have to do extra job just to send, so that whatever I have in here, I don't touch it. So then I have extra to send. But on the other hand, I don't do overtime as well. When I remember I was working in the bedside, and then when I worked 12 hours, if I work 4 days straight, 12 hours, that's too much already for me. But I have to do it because it's part of my schedule. But on the 5th day, I'm not taking it. But, because of the shortage, they will offer you, would you like to have, to work tomorrow? Would you like to work tomorrow? And then if you're thinking of the money, oh, yeah, that will be it could be time and a half because that's already overtime. So then you're thinking
Right.
of the money. And then, of course, they want to. And on the other hand, they're not, how about your health? But with me, I never go beyond. Some of my coworkers will fight for overtimes. Oh, why are you taking those overtimes?
Right.
It's supposed to be me. But I'm the one who will turn my back with overtimes. When somebody asked me, would you like to work on the 5th day? I said, I will work if you cannot find anyone, but you have to put me in a stretcher, wheel me in the stretcher, and I start giving pills. And then they know already that I'm not doing it. Because I will never do
Yeah.
it. Because I learned my lesson over the
I
years
hope
that
not
I'm
the
working.
hard way. I hope you didn't learn the lesson the hard way.
Well-
Because some people, their health will suffer, and then they wish they didn't take
Yeah.
the overtime so many times. No, of course we understand it. It's always a challenge of balance,
Yes.
right? But who will be sending them money home when you're in a stretcher?
Yes, correct. And when you're already dead, right? So I see a lot of health workers like that. So with me, I'm one thing with me probably, because I'm very focused on what I want to do. I was doing bedside, and I was doing also my graduate studies at the same time. I just take whatever opportunity I can have from the hospital. They offered me, that they will pay for my graduate studies. Then, provided that I will work full time at the same time. So then it's a hard work. But I always wanted to finish my graduate studies. So then, regardless of what barriers in there, I will
Right.
move on with whatever I
That's
want.
the thing with knowing what you want.
Yes.
Whatever
So
it
nobody
takes.
can shake in me.
Right.
Of course, I have detractors too on the side, but I don't care about the detractors. I just move forward with what I want to do.
Okay, before I forget, people want to know the cost.
Oh, yes, you asked me that. So for the personal support worker, it's the total school cost is 5,435. That already includes their tuition fee, all the book materials that they have, all the certifications that they need for employment on top of the personal support worker certificate are already there. There's the mental health first aid certificate, gentle persuasive approach certificate. All the certificates that the employer will be looking when they apply for a job are already in that package. We put it as a package, on not just as piece by piece, so that all our students are already trained with what the employer needs. That's the personal support worker, which is 5,435, and they can go in an installment payment plan. So they don't need to pay the whole amount, and they can spread it to 6 months, and so that it's easier for them to pay. And then for the developmental service worker, the school fee is $6,000. That's already the whole school fee for that 1-year diploma program. And the food service worker, it's more, and they can go on a payment plan as well. With the food service worker, it's 2,330, I believe. I'm not exact, but somewhere
in that
there.
vicinity, at
Yeah,
least
somewhere
they know.
there. And
They
then
have
they
an
can go on a
idea
payment
on
plan. Yeah.
what to shell out.
Yeah.
But as you said, there are installment plans. You also have advanced programs, or did we cover everything?
Just the one for the IENs, certification courses for IENs that they need for employment. And the one that we have now is the micro-credentialing programs.
What does that mean?
The micro-credential, they're short courses, and then they can pile it up. So I have no time. Let me get a 6-week course, do that one, and then let's say...
Then it's very specific.
Very specific, and it could lead to a PSW, it could lead to a DSW. So let's say I took 4 courses, short courses, but those short courses can be credited to the to the bigger program.
So it can be a standalone. You have a micro
Yes.
program for this one.
Yes.
And you can present it to your employer, right?
Yes, yes.
Do they have certificates or
Yeah,
no?
they have certificate. In every program, let's say the shortest there could be 2 weeks or 4 weeks or 6 weeks, just very short. And then they can do it independently as well. On their
online?
own. Yeah, online.
Okay.
And then they take the online exam as well. And then we just pile those courses that they take. And then sometimes they said, you know what, it's time for me to finish my developmental service worker. I took 6 courses. So all those 6 courses that you took can be credited because we trained them anyway.
Right.
So it can be credited to the diploma program. Or the vocational program, whatever vocational program that they took. Because some students really have no time. And so the micro-credential is more flexible for them.
Right.
Rather than going straight to the vocational, especially with personal support worker, it's a strict course. It's like mini nursing. So, you have to abide the rules in there.
Right. So that's good to know. This is a Filipino-owned college for healthcare workers, and it's not one of those sham colleges that we hear about. A lot of the things in media, they're very careful about the quality, the standard that they offer, and they offer the Filipino kind of care, for the students, being headed by Grace here. Is there anything else that you would like to share with us?
One thing with the school, which we are known for that as well with our students, we're very transparent day one. Student knows what to expect because I always tell my staff as well. And they can see that in me as well. Transparency matters to me. So I don't want that the student in the middle, I didn't know this one. How come that we're paying for another fees? So right there, we lay down what's expected. And then they always ask me, is there another fees that we will be expecting later on? No, this is what it is. And if somebody will ask you for more extra fees, you come to me. That's why all my students have my direct number. Because I don't want my students to go, I'm hesitant to talk to, work. So I don't want them to go from one person to another person. If they have issues and my staff cannot settle it, they have the option to go straight to me. And I answer phones even at night.
That's very unusual to be able to go straight. Well, maybe here in Canada, it's not that unusual. But all 200 students, can go straight to
They
you
have my direct number. That's why one of my staff says, Miss Grace, your students have the direct number. Should we eliminate your direct number to the business card? I said, no, don't do that one. Just because they will be bothering you. It doesn't matter to me. It's my business. I own the business, and it is important for me that they bother me. It's better that they call me. So then, whatever their issues are, I'm the one who can address it. Not my staff. It's me. So if they have to resolve it, they have to talk to me directly. That it's better that way. Then no more channels.
Right.
No more you go from one person, then pass on to another person. No, if your problems are not resolved right away, you go straight to me. And mind you, I give mental health first aid to anyone there.
And that
a lot
is
of times.
That's a free service.
I remember
that you give.
just quickly, if we have time.
Yeah.
I remember there was one applicant. She seems to be really in distress. And mind you, early morning, somebody was my phone was popping, making noise. I said, who is this? And she said, and in the text, there were 80 to 100 texts in there.
From one person.
From one person. And she was blaming me that I took her bakery and all her stuff. And she was blaming me for all those things. And then, normally, what you will do is you will block that person. But I know, because I'm also a mental health first aid coach. So I train my students to how to do mental health first aid. So I know that the person is on a mental health distress. So 5 a.m., she was texting me 4 a.m., 3 a.m., 4 a.m., 5 a.m. I couldn't resist, so I called her. I said, is there anything I can help you with? Are you okay? So when I asked, are you okay? And she suddenly said, yes, help me. And then she never mentioned about the things that she's accusing me.
Supposedly, yeah.
Yes, but she immediately asked me, told me her issues. And she said, I asked her, are you planning to hurt yourself? She said, not right now, but I may. So with that, I said, would you want me to call 911? We'll take you to the hospital if you need help. She said, please help me. So then I called 911. Wow. She basically went to the hospital. That she was there for 2 weeks in the hospital, meaning that they admitted her in the hospital because she's in crisis. And then, mind you, she came back to me after 2 months and she said, because when she came to me, she gave me a whole check for the whole tuition fee of the personal support worker program. And then, but I know something is wrong with her. So I did not, deposit the money. So I keep it in her file. When she came back after 2 months, and she said, my doctor advised me not to do this course because it's too stressful for me. She said, can I have my money back? And then I gave her back her check. And she said, oh, you did not withdraw? No, it's okay. So then there goes, something like that. I said, I'm glad that you came to me. If
you're not personally involved, then you would not have. That would have fallen in the cracks, and that would have worsened her mental health. And that's one person. That's what we also, want to advocate for, that each and every one of us can make a difference in other people's lives, especially if we just keep ourselves in tune with what they're going through. We're all busy. Especially life here in Canada. We're all busy, but every now and then, when you meet someone, look them in the eye, or just that small phrase, a sentence that asks, are you okay? What can I do to help? That's a very powerful sentence, apparently. What can I do to help?
At least you saved that person's life. God knows what will happen to her. I could have turned my back with her. It's a nuisance. She's texting me almost 100 text messages in there. And then I could have just blocked her and move on with my life. But then something I said, there's something wrong with this person, because I understand what's going on. It's just something is wrong with this person. Then
you should also have a program on mental health.
We do mental health first aid.
Okay.
All my students are mental health first aid certified.
All the students.
All the students.
from
Nobody
these different
graduates.
programs.
Nobody graduates unless you're mental health first aid
Is this
certified.
something that you put in there yourself, or this is a requirement
Well,
for
like,
all?
you know, because I'm trained with the Mental Health Commission. I'm
Right.
a certified coach for Mental Health Commission of Canada to do the mental health first aid. And that's why it becomes my advocacy as well that,
It's part of
yeah,
their
it's part,
program.
that I put it as part of the course, even the food
So it's not
service
a
worker.
requirement.
Yeah, I made them
Which is good.
mandatory.
Which is good.
Yeah.
Yeah.
It's not only for their clients, but also for their family,
Yeah,
for their
that's true.
friends, right? So
That's
then
true.
it helps for them. And then at the same time, like, you know, it will reduce the barrier of stigma, right? You know how people stigmatize people living with mental health issue.
That's true.
Yeah, so it becomes my advocacy as well to train to train my students to be mentally health aware of what mental health issues are, because after all, they're dealing with people who are vulnerable. And
Right.
it's not uncommon for people who are elderly who end up having mental health issues. It's
Right.
not uncommon for people living with developmental disability to have mental health
So
issues.
this is arming them with a lot of skills, not just in their work, but also in their personal lives as well.
and protecting themselves as well. They know how to interact, they know how to respond, because with mental health issues, you cannot see the problem.
Yeah, we know that, like what happened with the Lapu-Lapu
Yes,
incident.
yes.
And with so many other things
Yeah,
that are
so
happening all over
that's
the world.
right.
Recently, there was, again, another one in Liverpool that just drove through the crowd. And this has been happening more than it should,
Yes.
right? And we don't see it. We think people are okay. At least they look okay.
Yes, because
Someone
it's
who's been
very
working with
subjective.
us, like right beside
Yes.
you. But you've been at the helm since 2016, 2011? Was it 2016 when you got this, when you purchased
No,
the school?
2011.
2011.
Yes.
So you've been at the helm, and it's been more than 10 years, and you grew it to 200 students. That's not a joke. That's a lot of students in the healthcare business. And I am so humbled and happy to hear about the principles that go behind your operations of this school. Also knowing that this is Filipino-owned, and there's a lot of Filipino who are students in the school as well.
Yes.
We're looking forward to seeing more graduates who have that kind of standard that you have started in this school. And before I let you go, I want to ask you about being a nurse leader. What does that mean for you, especially being in a minority group?
Being a nurse leader, especially that I'm a Filipino, it means a lot. It will show to other Filipinos that, you know what, I can be like that too, or maybe better, right? So then, like, you know, it won't stop them from dreaming what they want to achieve here in Canada. And I always say that if others can do it, you can do it too. Don't stop yourself from, like, you know, from wanting what you want. And if you want to be, and I really want more leaders, in my industry, I want more Filipino leaders out there, because we have good leaders. Just going into the IFCNA, I could see good leaders in there.
When Grace mentions the IFCNA, she's pertaining to the Federation of Filipino-Canadian Nurses, who help each other in terms of so many different aspects: credential recognition, skills upgrade. You know, there's that group that can help you if you're a Filipino IEN here in Canada.
Yeah. So I want, and not only the nurses, but, like, you know, with women that I take care, like an abuse women, because I have a lot of students who were victim of abuse, and then, like, you know, I want them to be empowered as a woman, like, you know, and I want them to show that, you know what, don't call yourself you're just a woman, you're a woman, and you have more capacity to do that, to do what others can do. So, and that's when it makes me feel good when I see my student come back to me and say, you know what, I have this, like, you know, her husband was prohibiting her from doing things. She don't even know how to, like, she'd been here for 18 years and she couldn't even count Canadian money because she don't hold money.
Oh,
So,
wow.
and then when she started doing the PSW, because the social worker came to me, Grace, can you help this? Like, she's in the shelter, her husband kicked her out, and so would her children in the house. And now she's with us, and can you help her? And mind you, I said, yes, absolutely. And she said, I want to become a nurse, but I don't know how to count money. I said, no, come here. Let me. And mind you, I just realized as she goes with the PSW program, she was really smart. I said,
Yeah.
you are one smart woman.
Right.
And she said, but my husband told me I'm not smart. No, you are. And the more I'm more encouraged to power her up. And mind you, she finished, and now she's taking. I think she finished her nursing now, and she got out of that relationship, that abusive relationship. It was not easy. As
Right.
well, our journey together, it was not easy, but she was able to make it, and it feels good that when you
Right.
empower another woman, and then you can see
Right.
here, she's standing and she said, now, Grace, I'm driving. Good for you, you're driving.
Yeah, when you can make a difference, and
Yes.
you feel that a lot of not just Filipinos, but a lot of women in the minority group can pursue a leadership role
Yes.
because the experience that you get, actually the hardships and the struggles that you went through, being either racialized, or a minority, or just your life struggles, is very enriching for you to become a mentor to another
Yes,
person when you
yes.
get to that position of leadership,
Yes.
right?
Yes,
Okay,
that's true.
thank you so much, Grace. If there's anything else,
That's all.
it's
Thank
such a
you very much.
pleasure to have this conversation with you and to have you in our
it's a
program.
pleasure to
Thank you
be
very
here.
much. And thank you all for joining us on this episode of Thrive in Canada, as we have seen through Grace Lanceta's journey and the impactful work of CRD College. Education is not just about acquiring credentials. It's about building a resilient and compassionate healthcare workforce that reflects also the diversity of Canada. Internationally educated nurses and newcomers from various backgrounds are stepping up to meet Canada's growing healthcare needs. Notably, immigrants from the Philippines have made significant contributions. In 2016, they accounted for nearly one-third of adult immigrants in nursing and healthcare support occupations in Canada, totaling to approximately 44,380 individuals. Whether you're a newcomer exploring a career in healthcare, a professional seeking to upgrade your skills, or someone inspired by Grace's entrepreneurial path, for example, remember that your journey is valid, your contributions are valuable, and there are institutions like CRD College that are ready to support your journey. So before we end, I forgot to get your contact numbers for those who are watching us.
Well, if you want to get in touch with CRD College, you can check our website, www.crdcollege.com, or you can email crdcollegeinfo@crdcollege.com, or you can call 905-276-2872, or my number, 416-841-8768.
And that might be Grace's personal number. We'll see you again next time on Thrive in Canada.